Today, I'm glad to announce that Covax has signed an agreement with Pfizer-BioNTech for up to 40 million doses of its vaccine. Additionally, pending WHO emergency use listing, we expect almost 150 million doses of the AstraZeneca Oxford vaccine to be available for distribution by Covax in the first quarter of this year. Together, these announcements mean Covax could begin delivering doses in February.
To a journalist question, I remind you that you need to raise your hand.
Covax is on track to deliver 2 billion doses by the end of this year.
Announcement. I wondered if you could comment on whether or not WHO is advising the international.
And we believe that Gavi's coordination of a COVAX advanced market commitment that supports the participation of 92 lower, middle, and low-income economies is an important tool that will help to ensure that developing countries have the same access to vaccines as the rest of the world. And we will provide the vaccine to Covax for these countries at a not-for-profit base. In this context, I'm very pleased to share that Pfizer and BioNTech have reached an advance purchase agreement with the Covax facility for up to 40 million initial doses of our COVID-19 vaccine. We expect the first doses will be delivered in the first quarter of this year.
Helen Branswell to ask her question. Helen, are you with us?
All hypotheses are on the table. And it is definitely too early to come to a conclusion of exactly where this virus started, either within or without China. There are different observations, and I will call them observations, scientific observations in different parts of the world. Virus been cultured off different surfaces, virus in sewage, potential serology in some places, around potentially implicating earlier infection. And all of that's very important because it builds up a picture. This is a big jigsaw puzzle. And you cannot tell what the image says by looking at one piece in a 10,000-piece jigsaw puzzle. You can guess, and you're entitled to your guess, and you're entitled to your opinion, but that doesn't make you right.
Thank you. I would like now to ask Naomi from Bloomberg News.
That if you have increased transmissibility, you will have more cases. I know that might sound obvious, but you'll have more cases, you'll have more hospitalizations, and you'll have more people, an overburdened healthcare system. And in a situation where you have an overburdened healthcare system, you can have increased deaths because the system is overwhelmed. And doctors and nurses who are working incredibly hard to save as many lives as they can don't have as much time with patients, they're overburdened. And so we emphasize that no matter what virus is circulating, virus variants or not, we have to do everything we can to reduce transmission.
Question. Tomo, you have the floor.
This is really evolving information, and there are a number of ways that evaluations can be done to understand whether or not any of the variants whether any of the vaccines are less effective against the variants. And I think it's important to say that it's too early at this point to really have clear information on that.